Vitamin B12 doses, what nobody is telling you. I'm going to share some very curious information about vitamin B12, stories that are almost surreal, but that may relate to what you're experiencing. I'll also bring updates about vitamin B12 and present some new and updated data. This is a mandatory video for every human being on planet Earth, because vitamin B12 is involved in almost everything. It's a video you must share with your family and friends. And what comes next will shock you. There is a statement from one of the world's greatest scientists about vitamin B12 that changes everything you think about supplementation. The statement that will change everything you think about supplementation. One of the great scientists and researchers on vitamin B12 in the world said, "All people who do not supplement vitamin B12 have vitamin B12 insufficiency." In other words, if you don't use vitamin B12, you will never have vitamin B12 at the ideal level for your body. This is something shocking. There are other studies published by a well-known endocrinologist stating that 40% of the population has vitamin B12 insufficiency. And now I want to share some shocking stories. So shocking that, until I verified the sources, I was afraid they might be fake news, but they are not. The first is about a patient who, upon turning 60, became paraplegic, stopped moving from the waist down with no explanation. She was evaluated by neurologists and neurosurgeons, and all tests came back completely normal. However, she had extremely low vitamin B12 at minimal levels, and they ended up discovering she had a mutation in vitamin B12 metabolism, showing that such low levels can even lead to paraplegia. But the shocking cases don't stop there. The next one involves a severe psychiatric disorder and improvement in just 10 days. Psychotic episode, chronic fatigue, and a vitamin in common. Another case, a patient with a psychotic episode, an extremely severe disorder in which the person loses touch with reality. He started supplementing vitamin B12, even though his levels were within the reference range, and in 10 days the psychotic episodes disappeared completely. Another widely cited case involves people with chronic fatigue, who wake up tired and go to sleep tired, who no longer produce anything. After starting vitamin B12 supplementation, within 14 days they were already noticing significant improvement, after trying multivitamins and a number of other things with no results. These cases show that vitamin B12 may be behind conditions that seem to have no explanation. And the next case I'm going to share was told to me just a few days ago, during a lunch. And it is the most surprising of all. The nearly 90-year-old woman who got trapped in an elevator. A case was told to me by a family member during a lunch. She told me about an elderly woman in her family, nearly 90 years old, extremely active. She was the kind of person you'd say, "I want to reach 90 years old just like her." She traveled alone and did everything by herself. But she ended up getting trapped inside an elevator for a long time, a few months ago, and developed post-traumatic stress. She became a different person, quiet, not even wanting to receive her own children at home. They ran tests and examined everything about her. Result: normal. It was then that a doctor decided to supplement vitamin B12 in this patient, even though her levels were within the normal reference range. This shocked me deeply, and I will explain why this detail about reference levels is far more important than it seems. The return of a woman and the debate about reference values. The patient began supplementation with an injectable and then moved on to oral vitamin B12, and she returned to being exactly as she had always been. What a shocking thing, especially being told by an acquaintance of mine who is also a doctor. This case impacted me so much that I began researching vitamin B12 more and more. Because most doctors only order vitamin B12 tests for elderly patients or for vegetarians and vegans, since the main sources come from animal products such as meats, dairy, and fish. Everyone must have their vitamin B12 measured. It is mandatory. And why is it so important? What does it do inside the body that justifies all of this? What vitamin B12 does inside your body? Vitamin B12 is responsible for the formation of red blood cells. Low levels can cause a condition called megaloblastic anemia. In a blood count, there is an indicator called MCV, which when elevated can indicate this anemia. When red blood cells are enlarged, they cannot transport oxygen correctly, which is why many people are anemic, feeling weak, and with little capacity for physical activity. Vitamin B12 is entirely related to maintaining the structure of neurons and nerves because of the myelin sheath. With vitamin B12 deficiency, symptoms such as poor memory, low cognition, difficulty interpreting information, difficulty remembering, dementia appear, and it is being linked to the onset of Alzheimer's disease, as well as muscular dystrophies due to neurological problems. Vitamin B12 is also entirely related to homocysteine metabolism. Learn this with me. When homocysteine is high, it means vitamin B12 deficiency. It goes and breaks down homocysteine into methionine, because if homocysteine rises, it increases the risk of stroke, heart attack, and thrombosis, including deep vein thrombosis, which can lead to embolisms in various organs, including pulmonary embolism. And the symptoms that indicate this deficiency are more common than you might imagine. The symptoms that indicate vitamin B12 deficiency. People with vitamin B12 deficiency may experience tiredness, fatigue, and body aches. It doesn't mean that all symptoms need to be present. Cramps may occur, and something very related to my field, coloproctology, which is gastrointestinal tract disorders, including both constipation and diarrhea. This happens because vitamin B12 helps with cell regeneration, and our digestive tract has very rapid cell renewal. It is also related to leaky gut syndrome. People who are feeling sadder than usual, with a tendency toward depression, may also have low vitamin B12. That's how important this vitamin is. But now comes the most debated part among doctors. What is the ideal value you should have on your test? The reference value that is generating a lot of discussion. I want to open a parenthesis. Everyone must consult a doctor to request vitamin B12 testing. I am not here trying to prescribe anything for anyone. I am explaining how I, Dr. Fernando Lemos, think about it. And I will even suggest which product I find good, which brand I find good. But I want you to see a doctor to be guided. Most laboratories have reference values that vary depending on the methodology, but most set the range between 190 and 490. This reference value is a statistical calculation that considers that 95% of the population should be within that level. But what current studies are suggesting goes far beyond that, and well-known endocrinologists, neurologists, and psychiatrists are already completely changing the way they treat their patients. The number that specialists are using now. Current studies are suggesting that we should be at a minimum of around 800 for vitamin B12. There are people citing, and I have already received content on social media from well-known endocrinologists, neurologists, and psychiatrists, including many I know personally, who say, in my patients, I maintain between 1,100 and 1,500 micrograms per liter of vitamin B12. My thinking is a little more conservative, keeping it around 800. Before, I liked to keep my patients at 500, but I started reading many journals and studies, and found it interesting to maintain roughly around 800. If it's at 900 or 1,000, that's fine. If it's at 750, that's also okay. But keeping it more or less around 800 would be very interesting to gain all the benefits and avoid all the side effects of the deficiency I have been mentioning. And exactly how much should you supplement per day? The right dose of vitamin B12 for each person. Many will ask me how I like to replenish vitamin B12. Some people need to replenish 100 micrograms per day, others 200 micrograms, which is the guidance I prefer most. There are people who need to replenish 1,000 micrograms. For those who want to start supplementing without seeing a doctor first, to then have their vitamin B12 tested, the 200 microgram guidance is quite appropriate. Regarding multivitamins, folks, that is almost a joke. Multivitamins contain 5 or 10 micrograms of vitamin B12. The ideal for us is 200 micrograms per day. Of course, people with very low levels will need to use much more, 500, 700, 1,000, and the doctor will make the necessary adjustment. There are sublingual brands and also the well-known injectable cytinurin. There is vitamin B complex, but I prefer to supplement only vitamin B12 itself. And there is now a product with technology that promises absorption up to 10 times greater than conventional supplements. The nanotechnology that changes vitamin B12 absorption. A vitamin B12 product with nanotechnology was launched recently. I will leave the name of this product in the video description, which appears below the title. It is Nanoactive B12. I found it very interesting and went to study it, gathered the bibliography to go deeper. What is this product? It is a vitamin B12 in drops, but with nanotechnology. When we talk about nanotechnology, we think of much better bioavailability, faster and more efficient absorption, up to 10 times greater. Nanotechnology fragments methylcobalamin, which is the active ingredient of vitamin B12, into ultra-small particles, which greatly facilitates absorption. Roughly speaking, one drop contains 9.9 micrograms, rounding to 10 micrograms per drop, so I recommend 20 drops per day. Vitamin B12 is fat-soluble. It doesn't matter whether you take it before or after food. There is no mandatory correct time, but I like to take it after breakfast or after lunch. The final summary and the invitation that can change your health. 20 drops per day represent 200 micrograms, which is what the average person needs to supplement. Afterwards, you test your vitamin B12 and, if you need to increase the dose, it is quite easy to adjust. 10 drops are 100 micrograms. 20 drops are 200 micrograms. What is important is to supplement vitamin B12. I don't know why this isn't being talked about more at medical conferences. We all need to have this knowledge. So share this video, as it will save many lives.